Hello everybody, good afternoon.
Good afternoon.
So I'm Dr. Sanchali Talukdar. I'm one of the gynecologists and obstetricians in AMRI Mukundapur hospital. And today we have one of the very famous breast surgeons of Eastern India, Dr. Tapti Sen, who is based mainly in AMRI Mukundapur. So today we are going to have a discussion as what as gynecologist I face in terms of, or in general as gynecologists face in terms of breast problem, and also what Dr. Tapti Sen can throw light regarding prevention of breast cancer or other benign non-cancerous breast diseases. So a warm welcome. So my first query is that as gynecologists we always face women who are coming with us. Firstly, most common is the breast pain.
Exactly.
So as gynecologists we do ultrasound of both breast, and then we find different kinds of diagnosis. So can you throw a light when, in which case we should refer, or we should refer in all cases or not?
Let me tell you, in the beginning, I'm very honored that this interview is taken by the gynecologist, because in our country, as such, breast is not considered as a specialty. It's in Western world since last 40-50 years. It's a specialty. Different breast department is available. Hospitals are available. They are doing exclusive breast diseases treatment. In our country, the first anybody is having any breast problem, they go to gynecologist.
Yes.
And I'm very happy that a gynecologist is consulting, asking me these questions, and you're most welcome. Yes, breast is we have lots of problem regarding breast, It's not only the pain and the lump. Whenever we think about the breast problem, the first thing comes in our mind is a cancer. Anybody who is having any breast problem, the first thing comes in our mind is a cancer. But let me tell you, in the beginning, all the breast diseases are problem, 95% are non-cancerous, and only 5% breast diseases are cancerous. So we focus all our, whatever studies or whatever investigations on detecting the cancer, and we are forgetting the 95% diseases, breast diseases, which are benign. So first thing we should know that for any breast diseases, we have to go consult. And for the gynecologist, which is very important, that we cannot say that don't go to gynecologist, because the most of the patient, 90% patients, they go to the gynecologist. But one thing, when to refer the case to a specialist.
Yes.
This is very important.
Yes.
We get a lot of delayed cases because of the lack of diagnosis or lack of awareness, or just because the patient was not referred at the right time, which is very, very important. We want that the gynecologist should treat the patients, because of course, the patient is coming to you. But then there are certain things, when we have to know the symptoms. The patients also should know the symptoms, and a gynecologist should also refer the case to the breast surgeon or a surgeon who is treating the breast. So there are certain things, the common symptoms you can ask me, what are the common symptoms? Common symptoms about the breast, which is pain. Most of the patients are having pain, and you'll be very, very surprised. The patient come to me more with the pain than with the cancer. So if there is a pain, patient will consult a doctor. But pain is most of the time there's a cyclic mastalgia, mostly related to the hormone, and so these are the reasons which actually can be treated medically. Do not require much of a treatment. Counseling is most important, and sometimes some treatments are required when it starts hampering your lifestyle. Then you have to treat the breast pain. Another is fibroadenosis, lumpiness in the breast. People confuse lumpiness with the lump. So most of the time there's a lumpiness. People think that the breast is a soft and it's not lumpy, because after the childbirth and all that, it becomes very lumpy. So lumpiness and having a lump is two different things. Lumpiness, fibroadenosis, it does not require any surgery. Most of the time, it's very difficult to treat fibroadenosis than the cancer, because we cannot tell the person. People keep on feeling the lump, and actually this is a lumpiness. So these are the things a gynecologist can easily, find out. The most very simple way of finding a tumor or a breast disease is self-breast examination. Every girl should go for self-breast examination at the time when? Since puberty. Since puberty, once the breast starts developing, people should go for, they should start examining their breast, because most of the benign diseases are common in the young girl. Like, mastitis is there,
Yes.
any deformity is there,
Yes.
sometimes a nipple retraction is there, serious discharges can be there, and the most of the important thing is the fibroadenomas, cysts. These are very common in young girls, growing girls. And then simple thing is self-breast examination, and then you go for a clinical examination. When to go for a clinical examination? If you have any simple problem, any breast problem, go for clinical examination. And when to go for investigations now? Very important. What investigations? Self-breast examination, clinical examination. Now the gynecologist, suppose she's there, if she feels there is a lump in the breast, go for ultrasonography, which is very, very common. And here I would like to tell, this is very important, that where you're going for an ultrasonography, because nowadays which we are seeing that it is very difficult, called, there is something categories, breast tumor categories or breast disease categories in ultrasound and mammography. We call BIRADS sort of. I'll not go into detail about that, but there is BIRADS 1, BIRADS 2, BIRADS 3, BIRADS 4. These are the categories. So BIRADS 0 is that you cannot comment on it. BIRADS 1 is benign. BIRADS 1 is normal breast. BIRADS 2 is benign. BIRADS 3 is non-cancerous. BIRADS 3 is something, go and follow. You need a follow-up.
It may be radiological conservative.
Conservative. Yeah, yes. You don't have to, once, immediately treatment is not required, you can follow. But that depends on what kind of tumor. If it's a benign tumor is there, BIRADS 3, go for its removal. But chances of cancers are very less, 2% something maybe. So observation. Then BIRADS 4, suspicious of malignancy. BIRADS 4 is highly means you can say that this is BIRADS. This is a malignancy. Then BIRADS 6 is proved malignancy. Okay. So people are playing a lot of game in this. What we are finding in a lot of cases, that a patient is coming to us with the BIRADS 4. They're just writing BIRADS 4 and advising biopsies. So this is where the moment somebody says that BIRADS 4, people go and Google. And the moment they Google, there's a suspicious of malignancy. So this is very important that whenever you are getting an investigation done, even for gynecologists also, I'm telling you people, that whenever you're getting an investigation done, when these people write down BIRADS 4 and advise biopsy, I think so there, it's not, I am seeing 95% these biopsies are coming negative. 5% negativity and 95% positivity, that's a good center. But if 95% negativity and 5% positivity means it's not it's not done properly. So whenever you are getting yourself investigated, please be careful where you are going. Lot of coming that nowadays, lot of this, breast is a highly specialized branch, and commenting on a BIRADS 1, BIRADS 2, BIRADS 3, you need a highly, experienced radiologist. So any breast treatment is there, you have to have a good radiologist, good pathologist, and surgeon. I think so comes little later here in this stage.
Definitely.
So that is very important that you think where you are getting the patients investigated. And very important that unnecessary biopsies, cause a lot of mental trauma. Once a patient is said, no, you have got BIRADS 4, even if we say, don't go for this, nothing to worry, we are thinking this is not BIRADS 4, but once it is written BIRADS 4, they want to go for biopsy, and then they're all the time living in the fear of cancer.
Being a cancer.
So this is what, this other symptoms are nipple discharge. There's nothing to worry, because most of the time nipple discharge is because of some drugs which we are taking.
Yes, especially in older people, I have seen they are taking certain group of anti-vomiting agents.
Exactly.
And
domperidone and all this
I have seen that.
Antipsychotic drugs.
Yes.
These are the main common cause of this, secretion. So actually the secretion is caused by some other reason. Breast as such doesn't cause much of it unless and until there is ducticity or something like that. So that is the main reason that don't worry about the secretion. But if there is a blood secretion, single blood, so that could be a cause, but the commonest cause is infection. but there's papilloma can be there, which is a very small tumor in the duct, which causes, but most of the time this papilloma, non malignancy, hardly 10% bleeding ducts, are malignant, but that symptom should not be ignored. A lump should not be ignored. Bloody discharge should not be ignored. If there is any skin changes, that could be malignancy also. That could be other diseases. Underlying tuberculosis is very common nowadays. And then infection can cause the skin changes. If there is skin changes, thickening of the skin, or any redness of the skin, or there is a lump in the axilla, these are the things which should not be ignored. And if there is a very strong family history, in that case also you should actually, if you have any breast problem, get yourself checked. So it's very, very simple. Get a self-breast examination, a clinical examination, ultrasound. You should start around 40, up to a 40 you should, because if you do a mammography, that breast is so dense. So it's very difficult to mammographies to pick up the lesions. But if you have a full-field digital mammography, other mammographies are actually obsolete. Nowadays, nobody is going for conventional mammography. They're going for digital mammography. Digital mammography in a good center can pick up a just tumor less than 5 centimeter also. And then after 40 or 45, you should go for mammography. Don't get a mammography done without any consultations, advice. You should get a mammography done and somebody's advised you to go for a mammography.
So you're saying mammography should be done only if it is advised, not as a routine health check.
Not routine health check.
Unless you're high risk.
Unless you're high risk or 40-45 years old.
So after 45, even in routine health check, people should
mammography can be included, but not, I see mammography done in 18-year-old. But yes, sometimes I am also doing because the sad part is that in our country, in Asian country, breast cancer is increased 100-fold. We just don't know the cause of it. And the second thing is that what we are seeing in Asian girl, the breast cancer is common in young age group. Just now I diagnosed a lady she's pregnant, and she's got an intraductal papillary carcinoma. Another patient is 28-year-old. So somebody says that I should not do mammography because the patient is less than 40. No, that's not the. If a surgeon or the consultant thinks that it needs to be done, because when in case of cancer, we have to see the multicentricity.
Yes.
MRI is something which is done very commonly, should not be done, because it causes more confusion. If you've got a good mammography, ultrasonography, in that case, and a good pathologist. And another thing is that, which is now we are not doing, is FNSC. I see a lot of patients coming with FNSC. It causes more confusion. So if you have a lesion, go for true-cut biopsy. If required, USG guided or mammography, stereotactic mammography. But that is the way its approach is there.
And also one thing, for self-breast examination, should everybody learn it from a clinician first and then do it at home to know whether they're doing correctly? Or many people ask me, shall I just look into the YouTube? So what's your opinion regarding that?
Absolutely, this is absolutely, we should teach them. This is our duty. I think so. This is the society's duty, and our doctor's duty, is the gynecologist's duty. My duty to teach them how
not to do it through YouTube.
No, because I have seen a patient who has got such a big tumor, and she's just thinking that's a fibrolipoma. Okay, it feels like a breast, but fibrolipoma is 15 centimeters. She was just thinking that she's got a big breast. One breast is larger than the other. So one should really know how to look for it. Unless and until we teach them, I think so they're going to miss the tumors.
Can breast cancer be prevented?
Unfortunately, no. Breast cancer cannot be prevented.
Okay.
Like lung cancer, of course, if smoking and this, environmental, this pollution is taken care of, that can be, actually a lot of number will fall down. Oral cancer actually can be prevented if you take good care of your teeth and you don't take all these masalas, gutkas and whatever, the tobaccos, chewers and all that. So that will fall 95%. And even stomach cancer, if you don't take the steamed meat and all this thing, that can be taken care of. Cervical cancer, as
it's preventable.
It's at present, gynecologist, you definitely, this is actually infectious disease. Cervical cancer is because of the poor hygiene and multiple partners and smoking and all these things, but breast is not really even related to, people say that, you take drink more than 3 to 4 pegs a day, but that is not done. Obesity can be one of the cause, because we know the estrogen is the cause, and we know the estrogen is means produced in the fat also. So generally, fatty ladies generally have. But what we see in our Asian countries, the lady we say that who is not breastfed and all that, most of my 95% of my patients are breastfed. So they have the late pregnancy. We see the most of the pregnancies within 20, 25. We have early pregnancies. So they are coming with the cancers. So we cannot point out this exact cause of, what is creating this increase in the number.
Apart from the people who are already high risk due to family
history, we are seeing that, but 91% of our patients are not falling into any category, high risk category, family history, or 9% is having family history. So everybody, so that this, I'm saying that purposely because people think I don't have a family history, I am not elderly, I'm young, so I cannot have breast cancer. But then this is the message to the across to the whole ladies who are listening, all my, so that is that the 35 onwards, if you have a family history, go for, 30-35 in our country should go for regular checkup, clinical checkup. And in Western country, the breast cancer is for the elderly group, 50 onwards. In our country, we have seen that the most of the cases are 30 to 50. So they should come for regular checkup in early age group. So this is a very, this is message I wanted to convey. It's not that everybody's got cancer. As I'm telling you, 95% breast diseases are not cancerous. Only 5%, breast diseases are cancer. And if you have a lump, what is the possibility of having this cancer? 85% chances it's not cancerous. So only 10 to 15% chances you've got a breast tumor, which is cancer. And the most important, the sad part is that, we priority list of females are very low. So we don't go for regular checkups.
Yes, especially people who are not earning.
People who are not earning.
Yes.
So this is one
big problem.
That is a big problem. The priority list.
Same as, because I see female patients, so I see the people who are working, they sort of early to medical health. Those are not working, late most of the time.
Yes, so that is the saddest part. This is very sad part. Second thing, the financial thing. People do not have insurances and all that. First thing, the moment you have a tumor or a cancer diagnosed, you are not bothered about the benefit of the patient. When thinking about the patient, also thinking about how to go about it. Because most of the time we are not insurance covered. The government doesn't cover in all this thing. So it's a lot of helps coming from the government side, NGOs, and the government is also. But the thing is that our main problem is that you'll be very sad to hear there are so many families that what they say ki cancer to cure hobe. So cancer cure word we don't use, we use treatable use. Even diabetes we don't use cure. I can't cure your diabetes. I cannot cure your. You can't cure your PCOD also.
Yes, I tell all my patients.
How can I cure? When the cure cancer is very treatable in early stage. We don't even remove the breast. Patient get pregnant, have kids, go back to normal life. But then you come early. But just because, the lack of awareness, that this lack of,
access to
medical health, you're absolutely right. And then in between, which I request the gynecologist and other people who are seeing breast, early referrals should be done to specialists. And this is another thing, this is, they want an alternative path.
Yeah. Today I saw a patient with ovarian cancer. They asked me, can't be treated with medicine.
Every day I faced it. When every single adjust I saw today.
Can it be dissolved with medicine?
Today I saw around 10 cases with tumors, and every single person asked me, can we be treated by medicine? We don't want to go for surgery. And I just don't know why. There's a myth. There's a lot of myths attached to the breast diseases, which is not attached to the gynae thing and in other general surgery. Like if you have a gallbladder and you ask for surgery, they'll just go, okay, fine, when? If you've got an ovarian tumor and I've seen people, a lot of people coming from other countries, they don't even have, 90% they don't have uterus and they've been removed. So they don't question about that. But the moment it comes to the breast disease, everybody says that no, if we touch it will become, FNSC nahi karayenge, we will not get the FNSC, we will not get the biopsy done. Why so many myths attached to the breast tumor that if you touch breast tumor, it is going to be malignant. It will become malignancy. The people come and say that ki operation korichi ekhon cancer hoye geche. I said no, এটা cancer ছিল তাই এটা cancer বলছে. So this is a myth. A lot of people are spreading this myth about breast, that it's so easily palpable, it's so easily diagnosed. 90% breast disease are diagnosed by the patient themselves. But why they come late? Only lots of myth attached to it. As I said, priority list is low, female. Second is the financial problem. Third is very important, is a myth attached. And the fourth is promises made by alternative medicines. That just now I saw a patient is advanced breast cancer, and she has come because she is taking alternative medicine. So I'm not against alternative medicine, but I know my limitations. I cannot do surgery in this case. Like I have so many cases when I don't do surgery because I know I cannot do the surgery, spread. I should not be doing surgery. I should refer this to medical oncologist. So I don't do that. I know my limitations. I should not be doing that. They also should their limitations, that we should not do this. So everybody should their limitation and refer them to proper centers and proper consultants where the treatment is done, optimum treatment is done.
So what is your opinion regarding, do we have a comprehensive breast care under this roof of MRI Mukundapur?
I should be very proud to say that in the whole eastern zone, I think so, there is no as such department which caters to all kinds of breast diseases. In AMRI Mukundapur, we have, wherever you have, the centers, the cancer centers and all that, they have a department, breast unit, where they're treating breast cancer. Suppose a girl, 16, 17-year girl with fibroadenoma has to walk into cancer hospital to the breast department, the mental torture. As I said, 95% are not malignancy. So where should they go? So we have first time, in the whole eastern zone, a department exclusively dedicated for the breast, when all kinds of breast diseases are treated, benign, non and malignancy, all are treated. We have got mammography, we have got good ultrasound, we have got good biopsy we are doing, and good pathology department is there, good surgical department is there,
and medical oncologist.
And medical oncologist is there, and we have radiation in our other unit, the radiation center in Dakuria we have. So it's a comprehensive, that patient come in the morning and by evening we tell them, you need a biopsy, you don't need a biopsy. We almost do a diagnosis. Sometimes we do the biopsy the same day. True-cut biopsy we do the same day. Patient comes in the morning, by evening the biopsy is done. So this is what, the beauty of this department is, that it is not available anywhere, because you have a breast, we cater to all kinds of breast diseases and we cater to all age group. Like suppose a lady is 80-year-old, 70-year-old, okay fine, they can go to they're going to some places, cancer hospital there, but a girl of 16 years, she will think 20 times going to a cancer hospital.
Yes.
So the moment it's written cancer, we don't call it a cancer hospital or something, we call all the department of breast diseases. So very comfortable, and the whole atmosphere is very cordial, nice, so that people are not scared. We make it a very friendly atmosphere. They can walk in and we don't behave like, what has happened, like that. So very nice, cool atmosphere. The students come, we just talk to them. We spend a lot of time with the patients, make them comfortable. So got a good team which helps them also, to get the test done and all. So yes, in AMRI Mukundapur, we have got a comprehensive breast department which caters to all kinds of breast diseases, all age group and all kinds of breast diseases. So yes, I'm very proud to say that.
Okay, thank you very much for all the information. I'm sure that our general population will benefit from the information what we have discussed today. Thank you again very much for coming.
Most welcome. Thank you.